everyone have the lab sheet? It was either given out as a handout or it's on Blackboard for the Manhattan campus. Okay? So the first thing we want to do is check convergence and divergence. Okay? Which cranial nerve nuclei are we checking here? Ocular motor, cranial nerve 3. So we're looking for central signs, red flags, right? So first thing I want you to do is look at the tip of the pen here. Okay? I want it to be as a dot. Okay. Is that clear to you?
Yeah.
Is it blurry or double?
Nope.
Okay, so you want to clarify that it's not blurry, double, but you're starting at a clear point. Okay. Then you're going to stabilize the patient's head so that they can't compensate by turning their head. And I want you to follow this dot in and let me know when it becomes blurry or double. Okay? Let me know what the first point it does. And try to square off a little bit more. So turn your head slightly to the right. There we go. So follow this in as best you can. Let me know when it becomes blurry or double. Right there, so that's normal. Normal is about 3 inches. Okay? If he converges and he said, oh, let me give you a break. You don't have to look at it anymore. If he says, I see blurred vision at this point, that's abnormal. Right? The other thing we want to look at, in addition to his subjective description of when it's blurry or double, is how his eyes are coming together, right? Because cranial nerve 3 is in charge of many extraocular muscles, but specifically medial rectus. So we want the 2 medial recti to come together symmetrically and cause stable vision. Okay? So if this is not the case, remember this is different than vision, right? If you go to the eye doctor and they're looking at the acuity of your lens and the actual your vision 20/20, they're looking at the lens of the eye and the shape of it, right? This is convergence. This is like 2 spotlights on a stage coming together to focus on one object. If this is off, it's going to give you blurred vision, right? Even when your head is not moving. Make sense so far? Okay. The other thing you want to assess is once you come in, you want to bring the pen out. So let me start again. I want you to look at the tip of the pen here. Is that clear to you? Yeah. Okay. I'm going to bring it in. Let me know when it becomes blurry or double. Blurry. And then follow it out, follow it out, follow it out. Good. So I'm watching as he diverges as well. Convergence and divergence.
Is there smoothness?
Yes, smoothness can be, if it's not smooth, it can also be abnormal. That's not very common, but primarily you're looking for symmetry of the eyes and the point at which it gets blurry or double. What other questions do we have? Okay. Positive is a central sign. Possibly. Does anyone need to see that from a different angle? Okay. Next is smooth pursuit. So remember we talked about visual stability when the head is not moving. So we need a visual perception mechanism to keep the image on the fovea. And this is smooth pursuit. This is also at the brainstem level. So what I want you to do is follow this pen, the tip of this pen, wherever it goes, okay? To start, is this pen clear to you?
Yep.
Okay. I want you, and why do I need to make sure it's clear to start? Say it again.
To see if he's visually processing it in the normal fashion.
Yep. To see, well, additionally,
A baseline.
we want to make sure that, think about it this way, if this is blurry or double to start,
Right.
he's not going to be able to track it, right? It'll give us an incorrect positive. Exactly, a false positive. So we want to start where it's clear. So what I want you to do is follow this pen wherever it goes. Is that pen clear to you?
Yep.
Okay, you can see the dot clearly. Okay, follow it with your eyes only. And remember, we we talked about how the smooth pursuit operates at about, does not operate faster than 1 degree per second, right? That's more the VOR. So you want to make sure you're not waving your pen around too quickly. So you want to go in all planes, left, right, up and down, diagonally. And I'm looking to make sure that that his eyes are moving smoothly. Abnormal would be the eye would not be moving smoothly. It would be interrupted. We call them saccadic interruptions. But really what you're looking for is just anything that's not smooth. Okay? It's important to note over time, this deteriorates with age. So if you're looking at someone who's 80, 90, this may actually be abnormal. That can break down. But if it's someone younger, if it's someone not in the elderly category, and this is not, and his eyes are not moving smoothly, it's definitely a red flag. And like I said on the list, it's one of the signs to refer back to the MD if they don't have a reason for it.
What would you do if they're advanced in age? Like, would you still refer back? Would you ask them questions?
It's partially a judgment call. You know, you want to be looking for other red flags. You'll see that there are a lot of other areas that we're going to be looking at, and if you start to see things not add up or multiple red flags, then you're thinking that it's something that's worthwhile speaking to the MD. When in doubt, talk to the referring physician. But as you'll see, a lot of these things complement each other, and you'll start to see things connect. Okay. Any other questions with that? Next is ocular range of motion. And for this test, it's very similar to smooth pursuit in that you're still moving in different planes, but now you're just seeing how far his eyes can move. Because if he has a problem with his ocular range of motion, you know, some people have been in an accident or something where it's not a neurologic problem, but they may have damaged one of their recti muscles, or they may have had some sort of problem with the eye itself. So we just want to make sure that the eyes have full range of motion. Okay. So I'm looking at both eyes this time, and I'm just watching to see how far his eyes can move. See that? So instead of keeping it relatively within his range here, I'm now taking him all the way to the edge there. Okay? And I'm just watching his eyes to make sure that they can go to the end of the orbit. Okay? It's normal to have a little bit of blurred vision at the end. Okay? So I'm just watching his eyes there. Some people like to do a box. And then a plus. Anything to see all the planes of motion to make sure that he has the range of motion. Okay?
What's positive?
Positive is anything where his eyes can't achieve the end of the orbit. I have some videos on it. I'll show you guys so you can see what an abnormal range is. But for now, actually, with all of these tests, practice on a lot of each other because you'll be able to see what normal looks like so that when something's abnormal, you know right away.
So you're asking them if they can see it at the end of the range when you move?
No, you're just seeing how far they can go. Yeah.
What happens if someone's bilaterally limited? Would you pick up on the fact that they have less range of motion?
Be more specific.
So if someone can't, if they just have a shorter plus sign, you wouldn't necessarily know that they have less range of motion.
I see. Yeah, you want it to be symmetrical. That's a good
So
point.
is that normal then, if they're just limited?
Yes, that would be normal.
Oh, okay.
And part of that is also a judgment call where you don't, if they're severely limited symmetrically, it can also be a problem.
Okay.
We had someone come into the clinic with bilateral temporal lobe lesions, so they couldn't look to anywhere beyond where their fovea was spreading the image. So in other words, if I'm looking at you and I tell the person to look to one side, they couldn't go there without turning their head. So they were symmetrically limited on both sides, but it just wasn't the full range necessarily.
So that person would have had a limitation, right?
Yeah.
They have a range of motion limitation, it's just symmetrical.
Yep. Okay, so why don't you break apart, practice those for a little bit. Dr.